this is a question that we get quite often from people to ask doctors like yourself, and you have a different vantage point than most. Somebody gets diagnosed with cancer, and it's obviously a very scary situation, and we hear the stories that the oncologist will say, but we caught it early and we can start chemo treatments on Monday. What's your advice to that patient that's kind of overwhelmed and taking all that in? We hear a lot of people just say, just take a deep breath and wait. I mean, what should people do when they're in that spot?
Yeah, it's such a tough spot to be in, right? I mean, you're given all this information. You've heard the big C word. There's a little bit of a shock wave that's going through your body. There's probably some disbelief there. And it does take at least one, if not 50 deep breaths to truly just get back in the moment and integrate that information. I think taking a breath is a really great first step to getting centered and grounded in yourself so that you can make a good decision moving forward. There are certain tumor types where you need to move fast, that starting your chemotherapy on Monday might be life-saving for you. There's other tumor types where you can maybe wait a week or 2 or 3 and it wouldn't impact your overall survival or how you responded to treatments. So my advice would be, first of all, ask the oncologist, how fast is this moving? And even though you can start me on treatment on Monday, is that what I need to do? Is it life-saving for me to do that? Or can I go home and talk to my family and put together my team that's going to support me through this cancer diagnosis? I would highly recommend anybody put together a team before they jump off into the whirlwind of being diagnosed with cancer, because you're going to need people to support you with your diet, with your nutrition, with your supplements, with reducing side effects. You're going to need to, get your neighbors and friends involved to give you some support while you're going through therapy. So definitely just check in with your oncologist and make sure that you have to make an immediate decision right now, right here. And if not, take a couple of days, let the information soak in, get your team rallied around you, and move forward in a place of empowerment versus fear. I'm just really about facing cancer from a vantage point of empowerment. And a lot of times when we're rushing, we're making decisions because we're anxious or fearful about what's about to happen.